And she had no idea if her distress, which she would call anxiety, was caused from the actual pain. So the pain was causing anxiety, or if her anxiety was causing the pain. It,
Right.
it was so confounded in her own body that there was just no connection. So all she could do in the time is just wail in pain. It was mostly the
Oh,
stomach pain
honey.
because she was very she's very backed up, very constipated
Yeah.
from this cocktail of medication. So she wasn't moving. I remember meeting her the first time. I said, "How do you feel right now?" Because she just looked glazed, and she said, "I feel fine." But she was just, I mean, she was almost half asleep. And I said, "Do you notice
Shoot.
that your eyes are half open?" And she said, "No." And she kind of look at me like this. She had to do that because she didn't even have the muscle control to open her eyes fully.
Welcome to Whole by Design, the podcast exploring the human experience with compassion and curiosity. Together, we'll uncover powerful internal resources and tools to help you embrace clarity, joy, and your full potential because you are whole by design. Hi, everyone. On this week's episode, we will be diving into the overmedication, overprescribing that has run rampant, especially in youth today, with our very special guest, Dr. Britta of Pacific Quest. Stay until the end, where she's going to talk about the pillars of health that can really make a difference in changing the story around what your body is experiencing. She is the Chief Medical Officer for Pacific Quest in Hawaii, a beautiful, amazing program that takes mental health to a whole different level, and not just mental health, but whole body health, integrative medicine. She is an expert on this topic, and I'm so happy to be welcoming you to the program. Before we jump in, don't forget to check out our website, www.vivapartnership.com, for free and low-cost resources that can change your life. Thank you so much for joining us today, Dr. Britta.
Hi, Julie. Thanks for having me. It's great to be
It's, it's so awesome. So tell me, we got to talk a little bit a few weeks ago and then again today about all the amazing work that you do. But can you tell me a little bit about what you're seeing when you
here. Sure.
talk about this overprescribing that's happening in our culture?
Yes. Well, just for some context, I've been the chief medical officer of a residential treatment center since 2008, and
Mm.
it has changed significantly. So we bring in adolescents and young adults. They stay with us for about 3 months. And initially, in the first 5 years or so, when I was working there, they were maybe on one psychotropic medication, maybe none at all, and they were coming to get therapy and reset on the beautiful island of Hawaii. And then I noticed a trend, probably around 2012, and they were coming in with more and more medications. And I needed to get a more robust nursing crew because they were trying to sift through their medications and everything they were taking. And it seemed as if there was just one hammer hitting their mental health issues where they've gone to the course. I'm sure the parents start with a therapist, then they take them to the pediatrician. Maybe the pediatrician prescribes a, Prozac or an, ADHD medication. And then if that doesn't work, they take them to a psychiatrist. And I was getting young people, sometimes 14, 15-year-olds on 5 different
Oh
psychotropic
my
medications.
gosh. Oh my gosh. That's a lot for the body.
It was a lot, and they still needed to come to us. So I thought,
Right.
okay, these medications aren't quite doing the trick.
Right.
And then I went to this, it was pretty profound. I went to this conference, it was a 5-day conference, and it was a psychiatry conference. And I was there with about 100 psychiatrists, and it was all about integrative practice. And what I realized, I'm an integrative physician by training, but most of the other physicians were psychiatrists, and they were lost. And the common feeling was, we don't know what to do. Our patients are getting better, are not getting better, and we don't know how to help them because all we know is the medication, and the medications aren't doing it, and there's something more going on. Help us. And I networked. It was so great to meet these folks, and we learned about nutrition and other non-pharmaceutical ways to treat these people, some more of the causes of the mental health concerns, and it was 5 days intensive, and I'm still connected to these people, and they are practicing around the US, which is great because they knew they needed something else.
Well, I love this because it's a whole body approach, right? It's not just chemicals.
Correct.
And our brains work in interesting ways. I'm trained in neurofeedback. And so, of course, there's more than just chemicals that change the way that your system's working. Can you tell me about a case? So, you probably have tons of cases where people come in over medicated
Sure.
and give us an idea of what you're seeing, how you make a difference, how you help their body recover.
Yeah, absolutely. I like to tell you about one of my adolescent cases, but firstly, I think in general, what I hear from parents and the patients themselves, they're frustrated because they're taking all these medications and they feel like they should feel better. So that's almost like a moral failing because they're not feeling better.
Mm.
And so I really try to walk that back for them, saying that this is okay. We're going to figure this out. And just to be very clear, I'm not anti-medications. I've seen medications turn cases around, but it has to be the right one, the lowest, most effective dose. We all, as physicians, we all take the Hippocratic Oath to first do no harm. And in order to really do that, we have to have a comprehensive treatment plan that maybe does include medications, maybe not, but again, it's really treating the individual. So I like to tell you about this one case. It's significant. I even have a picture of her before and after, and it's just, for HIPAA, I cannot show you, but it's just amazing. She came in, she's 15 years old. She had come in actually from an acute hospitalization. And but before that, had been in and out of school and very, very very well educated family, and she was doing great in academics, but she did have a history of trauma. And this young girl came in on 6 different medications.
Oh
So
my
she had
gosh, at 15, I can't believe it.
15 years old. She was probably about 120 pounds, just
Shoot.
yeah, all this. So she had Adderall in the morning. She had lamotrigine, which is a mood stabilizer, Adderall's for ADHD, of course. She was taking gabapentin, which is an anti-anxiety, 3 times a day. It's also for pain. And then she was taking Zyprexa, which is an antipsychotic at night. And then she was taking Ativan or lorazepam. And when she came in, her eyes were half closed.
Of course.
And she was in so much pain, like physical pain. And
Right.
I think I listened to one of your other podcasts, is that you get this visceral pain that just does not go away. Once you have some type of GI issue, this pain it persists, right? And so
Right.
for her, she's gone through many medication trials. And one thing to notice, what I hear so much from patients is, or parents, they say, oh, they're medication resistant. It was just so interesting. It's like, no, it's just not the right combination, or maybe there's something else going on
Right.
because it's not a Prozac deficiency that's causing their depression. There, there,
Right.
there, there are other factors that's going on, or multiple failed medication trials. These are things I hear often from my patient
But
population.
can you imagine? You're talking about a 15-year-old who's really in this adolescent period where they're working on developing and separating and creating their sense of themselves. So if you're inundated with these words about failure or about,
Mhm.
oh gosh, the medications work, your 6 medications, and you're
Mhm.
exhausted and you can't open your eyes and you're in pain and your
Yeah.
body, your nerves are sending pain signals,
Mhm.
it's really tough on self-esteem, right? I'm basically broken, is what they're saying. And honestly,
Absolutely.
that is the opposite of what our podcast is all about. We believe the human body is whole by design, and it's
Yeah.
doing and giving us information all the time. So I'm sure you're about to tell us what kind of information you got from this young woman.
Sure. And when she felt distress or heightened distress, the first thing she asked for it was more Ativan.
Of course, that's how she'd been conditioned, right?
I know,
You have a
and
struggle, medication. You have a
yeah.
struggle, medication. Oh, here's another, let's add something else to the cocktail.
And she had no
Hmm.
idea if her distress, which she would call anxiety, was caused from the actual pain. So the pain was causing anxiety, or if her anxiety was causing the pain. it,
Right.
it was so confounded in her own body that there was just no connection. So all she could do in the time is just wail in pain. It was mostly the stomach
Oh,
pain
honey.
because she was she was very backed up, very constipated
Yeah.
from this cocktail of medication. So she wasn't moving. So and I remember meeting her the first time. I said, how do you feel right now? Because she just looked glazed, and she said, I feel fine. But she was just, I mean, she was almost half asleep. And I said, do you notice
Shoot.
that your eyes are half open? And she said, no. And she kind of like look at me like this. She had to do that because she didn't even have the muscle control to open her eyes fully.
What? Oh my gosh.
Yeah. So
So
fast forward,
I was gonna say, tell me, how did
yeah.
you bring this person back to life?
Yeah, so the first thing we needed to do is try to find a way to get her less dependent on Ativan. And that can be, for all of you guys listening, whoever has taken that on a regular basis, it can be one of the most difficult medications. The benzodiazepine class as a medications, most difficult medications to come off of. So I don't want to say, oh, we just take everyone off, because it can be also dangerous if you just abruptly start. So stop, that is. So it's really important to come up with a physician-tailored taper plan
Yeah.
for that class of medications. So we had to very slowly taper her down. And if you can imagine the resistance, how can you do this? It's the only thing that makes me feel better. So we had, and the way we do that at, with my integrative team is we substitute natural anxiolytics. So we use
Oh,
amino acids, for example, L-theanine,
right.
GABA, and these amino acids, they do not feel amazing like Ativan. Ativan, you take it, and my understanding is it's like right away you're just feeling, completely muted.
Oh,
These take the edge off in a way where they change your brain, those really over-excitatory brain waves. They act as like the brakes on the nervous system, but it's a slow brake. It's like the train going fast, and you can't just stop the train right away. You just slowly stop it. So we get those on board for them, to try to. So when she's asking for that lorazepam, or we were trying to, kind of incrementally decrease the dose, we would substitute those things for her. The other thing
mhm.
we were doing is having her eat 3 times a day. She just wasn't eating because her stomach hurt so much.
Of
Um,
course.
and then think about the confusing information for the body. She's taking an amphetamine-based ADHD medication and Ativan at the same time.
So it's
I,
like start and stop, just so confusing,
yes.
right?
And this was a prescribed regimen from a physician to this 15-year-old girl. I mean, this was her regimen.
Let me ask you, because you're telling one story, which I so appreciate, because then we can
Yeah.
kind of follow how you look at it differently, how you're
Mhm.
working with all the complexity of what it means to have this sophisticated human system with these different dimensions. But
Mhm.
how often are people coming in this way? Medicated with three, four, five, six
Out of,
medications.
out of our population, 95% of the adolescents and young adults are taking at least one psychotropic medication.
Yeah.
Now, when I review the application polypharmacy, which this is, I would say it's upwards 30%. Because
Wow.
what happens is they, let's say there's suicidal ideation, or there's like a depressive episode, or they're school refusing because they're feeling so anxious. The first line is a medication. So then they'll be given a medication, and then all of a sudden there's like another symptom, whether the symptom was already there or maybe it's a side effect of the
The
medication they're
first
giving.
medication. Yes.
So then they give another one to augment. It's very, very common to have an SSRI, Prozac, Lexapro, Zoloft, and they're like, oh, it's not quite taking care of their anxiety. So I'm going to augment it with a little Abilify, a little antipsychotic, or a little lithium, a mood stabilizer. I mean, this is common psychiatric practice. And again, I'm not saying it doesn't work for anybody, but I'm getting the kids who have been over medicated to the point where everyone's afraid to take them off the medications. Because if you can
Yeah.
imagine, they're in the outpatient psychiatry, all the medications are compounded. And then if they were to take them off their antidepressant and something happens at school, they get bullied, and then, I don't know, there's some type of episode, then it's the psychiatrist's fault. So everyone's afraid to take them off. And the other thing that's happening, even more of an issue is these medications are compounded, but they're not even at therapeutic doses all the time. So I think if you're going to try an SSRI, like get it to a dose high enough to see if it's actually going to work for the individual, rather than just giving these
Right.
little, sprinkles of different like non-therapeutic doses of medication. So it's kind of a mess. But I also think because there's so many variables in outpatient psychiatry that it's difficult. It's hard for them to
Yeah.
manage it. Yeah.
Well, and I think this is one of the things that draws me to you, your work, and Pacific Quest in general, is that we're simpatico on the understanding that each human system is unique,
Mhm.
right? You could, and I know we're going to talk about the pillars of health, which I think are really cornerstone and beautiful around how to move what's happening in the body and really
Yep.
listen to the fact that we're all
Yep.
snowflakes, right? That we come out differently, that what works for someone may not work for someone else. If you followed that same cocktail, there could be someone it's great for, right? And
Correct.
someone else that it literally takes the life out of them. And so, yeah, tell us more about the story. Tell us how this girl.
So this young lady, she in the first 4 weeks of her stay with us, it was rocky, because she would be having the pain, and we're slowly titrating her off. Of course, we're lucky that we have this kind of base of we have a therapeutic environment, and the kids
Yes.
are, even though they're having nice hot showers and they're sleeping indoors with AC if needed, but they're also outside 8 to 10 hours a day next to the water. They're getting therapy. So, so we have these built-in ways to kind of stabilize their nervous system, which is, I can tell. I'll just admit that I'm lucky because it's kind of easier to do my job in that context.
Yeah.
But we were able to slowly walk her through. The other thing we did is something called pharmacogenetic testing. It's a saliva swab, really well covered by insurance. It's just a buccal swab, and it tells us how the body is metabolizing certain medications. It's not a diagnostic test, but it tells us from a genetic variation standpoint how the body is metabolizing certain medications, and if there are transporter issues, like for example, there's a serotonin
Mm.
transporter. So don't even try that medication because it's not going to work from a genetic um,
Oh my gosh, the saved time and
genotype.
struggle.
It really helps guide the prescribing. And I can't tell you
Yes.
how many times we run this test. And I've been doing this test for over a decade. And just as a side note, when I started doing it, a lot of psychiatrists were like, what is that? There's, that doesn't make any sense. And there's no scientific backing. I would say 50% of my patients now come in with that type of testing already. So it's becoming more mainstream.
So
That's
great. I love that. I love
and
that. Everyone wants to learn. Everyone wants to do the best they can.
And
And
it's
we,
just guidance. It takes that guesswork out of prescribing. And so when I do this test on my patients, the patients themselves, the parents, they always have this aha moment. Like,
Mm.
oh, no wonder all those trials failed. No wonder,
Yes.
no wonder they gained 30 pounds on that antipsychotic. No wonder I mean,
And it's not a medication. What was the term you used? Medication failure or
it's not medication resistant or treatment failure.
yeah.
They just didn't get it. They
Yeah.
didn't get it specific to that individual. And this genetic test, one time, this is your genes, and it's genotype. So this is what could happen. It's not phenotype. It doesn't mean like this is how you're gonna be, but it gives you the genetic predisposition in order to
Right.
really right fit that medication prescribing
Love that.
if you need a medication. ADHD is a perfect example. There's two different classes of medications you can use, and this testing tells you which one is going to be more effective for ADHD.
Oh,
So,
great.
yeah, and you're able to really get the dosing right. They'll say if your body's going to metabolize it too quickly or too slowly, so you know where in that very large range of dosing we have for a lot of psychotropic medications, where to hit it. So anyway, we did that with her, and it was actually very helpful because it comes in this nice colored, result saying, "Hey, this is not a good medication for you. We're going to get you off of this one." So there was more buy-in on her part too.
And how many of her 6 medications were not good for her system?
Um,
Remember?
I would say three were
Oh
not
my gosh.
working. Yeah. And but she didn't need to be on those medications. That was those medications
Yeah.
were that was the Band-Aid. That, as I say, the only hammer they were using to hit the nail. I like to say with integrated, I do integrative psychiatry, nutritional psychiatry. My black bag, so to speak, is so large. It's not just medication prescribing. I have so many different tools I can use to help an individual. And for her, the only tool that had been used up to that point were medications.
Yeah.
Yeah.
So what was her prescription from you? Meaning
Sure.
what cracked the code for her? Because I'm assuming, I know we can't see the before and after. We know the
Hmm.
before, her eyes were like at half mast and she wasn't doing well and she was in a lot of pain. And my assumption is her after looked more alive and
Oh
vibrant.
my gosh. I showed her when she was the week before she discharged. She just was saying to me, "Oh, Dr. Britta, I feel so good. And I just led this exercise group." And she had all these fun stories. Of course, I see them every week, but she was really reflecting because she was sad that she was leaving, actually, from the beginning where she said, "I don't want to be here. Oh my gosh." Yeah.
Yes.
And I said to her, "Do you want to see a picture of yourself when you first got here?" And she said, "Oh, sure, that'd be interesting." And I showed it to her. And so, I took a picture of her right then because she was just bright-eyed and just her skin cleared up. I mean, you could just, the vitality was back, and
What a great word, vitality. I love
as a
that.
15-year-old should be. I mean,
Right.
absolutely. So I took a picture of her, kind of in the same place where I had snapped the picture at the very beginning, and I showed the other one. And she was just floored. And she did something with my phone that I would have no idea how to do because I'm too old. She's a teenager, where she split the screen and she had them side by side, the
Don't know
picture.
how to do that either. So,
And then and then she said, "Can I show this to some other people?" And then she went around and she showed it to her peers, and she was so proud of herself, but she had no idea. When she looked back at herself 10 weeks ago and just saw her eyes then half masked to now, I mean, even that alone. And she was telling him, "Look at my skin and look at my hair." It was pretty phenomenal, I have to
also,
say.
I'm sure that was so inspiring for the other people in the program. Like, look what I did. Look how I
Yes.
feel. I am like a living testimony that this can be different, that you can come back online, that, yeah,
Correct. Yeah.
it's so
So,
beautiful.
so what we did, not only did we right size her medications, optimize it, get her off at least half of those, get her off the anxiolytics, the Ativan. She didn't need that. Get her on more natural substitute for anxiety. Or if she started feeling those feelings of anxiousness, we would have her do something. We're right near these kind of cold ponds that go into the ocean. So
Mm.
she put her feet in there, or she could take a quick swim. And that's not always possible in our day-to-day life, but she really learned some self-soothing ways how she could regulate herself
Love
in
it.
the moment rather than in saying, "I just need my Ativan." Because
Yeah.
that's the message she got until this point. That's the
Yeah.
only way she could regulate herself is by taking a pill.
Yeah.
Yeah. Yeah. Yeah.
So great. So you expanded that.
So, and I just want to say, if I haven't either, there was a ton of resistance in the first 4 to 6 weeks. And everyone,
Mhm.
any of us taking medications and being told, "No, you don't need that." It feels like the rug's being pulled out underneath you. So you
Yeah.
really need to give a lot of support around that and really speak to that. Like, "We got you. We're going to support you." So the other thing we did with her is we did more lab panels. So we did blood work, very basic things: thyroid, vitamin D. We did an iron panel, just a complete blood count, just to see how everything was working. I like to measure something called CRP. It's C-reactive protein. It's a non-specific inflammatory marker in the body. I like to Young people should not have this elevated. It's more like a metabolic 50 to 70-year-old male or female will have this elevated because they have a lot of inflammation. But it's always interesting to me when I run this on my young people, because I'll do a lab panel at the beginning and the end to see from a data-driven standpoint how they improve. And her inflammatory marker was high. It was high. Yeah.
I bet it was for
Yeah.
lots of reasons,
Yeah.
but at least for those having 6 medications as part of her regular
Yeah.
daily routine.
And she was stressed, and stress is the number one cause of inflammation in the body, and you can't get
Yeah.
rid of stress, but how are you going to be managing it in your body? That's the question. So with this laboratory kind of little deeper dive, looking underneath the hood, and we look for the optimum levels of certain nutrients. We were able to replete her body more with nutrients. We did it with diet, but we also did it with supplements. And, and,
Love
and
that.
in the way that we were really trying to get those optimal levels, because we know vitamin D is anti-inflammatory when you get it in a certain range.
Yeah.
And the lab range is, for example, it's 20 I don't know, 100. And so if you have a 21, everyone says, oh, you're fine. But we know you need to have a 50 to 70 in order to really have that anti-inflammatory effects and for your immune system to work well and for your sleep to be okay.
Mhm.
So it's really trying to look into this young lady in particular and figure out what is out of balance that we can restore for her.
Yeah. And
Yeah.
I love that because it really speaks to the cookie cutter approaches don't work, right? You talk about a range, you talk about where they are. Someone could be great with vitamin D, someone else might not. Someone on medication might work well, not others. We're all so
Right.
different without getting more sophisticated to really custom tailor how you're directing and responding and intervening with any individual patient. It's
Yeah.
without doing that, you're really at risk for missing them and
Yep.
prescribing. And I'm not just talking about medical prescriptions, but prescribing nutrients that are wrong, prescribing
Right.
activities
Yep.
that are wrong. It really is much more delicate. So I love that.
And I have a little bit of an issue with some of these integrative physicians that kind of do the same tests on everybody, and they do a lot of tests, and it
Hmm.
can feel very overwhelming, where there's like the mold and the heavy metals and oh my gosh, just everything, which I'm not saying is not a problem for some people, but I think when someone's coming into the realm of really an integrative treatment plan, to try to make it as simple as possible at first and then you look for the zebras because I can't tell you how many people just haven't really gotten that far with their conventional pediatrician and then they go to a functional medicine doctor and then they're just so overwhelmed with the amount of information. And I guess what my point is make sure just the basics are handled first because so many of us are deficient in these nutrients and we're deficient because of our lifestyle. Stress
Yeah.
depletes the body. We know that it depletes of magnesium, of zinc, of B6. And we need those types of nutrients to make our neurotransmitters. It's
Yeah.
it's just science, it's just science. So if we're taking medications that supposedly work on the neurotransmitters, but we don't have the building blocks, then of course it's not going to work. So
Yeah.
that in its essence is nutritional psychiatry.
I
Really,
love that.
yeah, is treating, is figuring out, again, medications can work, they can, but alone, oftentimes they cannot. You need the
Right.
whole picture. Yeah,
I love what you're saying, right? If you don't have the basics, if you're not supported nutritionally to even have the neurotransmitters functioning in the way that they need to for the medication to be effective, then why take the medication?
right.
It's not going to do what you want it to do anyway. I love this. And I love the story. I love the story of this woman. I love even picturing how proud she was of herself
Oh,
and how
yeah, yeah.
spreading the good word. I love it. And actually, to be honest, I love how you're spreading the good word, especially about this way that you're working that feels so nurturing and caring as you're talking about it to really see someone as the individual that they are. So, believe it or not, Dr. Britta, we're pretty close to the end of our time. And I want to make sure that you have time to talk about those pillars of health because they feel like a real antidote to the seduction
Mhm.
of this widespread phenomena that's been happening in our culture around overprescribing. So, why don't
Yeah,
you tell us a little bit about those?
sure. And the next podcast, we can dive into inflammation and how that's the
Yes. Yes.
cornerstone
Yes.
of these chronic diseases, which happens to be mental health. But
Yes. You know,
these,
I love talking about that as a trauma expert because that's all I do is work on reducing the stress load in the body, which
yeah,
reduces inflammation.
that's right. That's right. And so the my pillars of health have everything to do with decreasing inflammation in the body. So that is making sure the nutrition is on track and doing that with just basic lab panels that you're nothing fancy, insurance covered, basic nutrient deficiency lab panels. And also food sensitivity slash intolerances. Figure out what those are for you as an individual. It's amazing how much brain fog and fatigue and mood lability that gluten, for example, can cause some people, not all, but some. So uncover that, figure that out, because food is mood. Food can really affect everything, around that. The second one is sleep. So many of us do not sleep well. And if your sleep is erratic, your cortisol is going to be erratic, and cortisol is that inflammatory hormone that we really have to be paying attention to. And that's a whole other podcast we can get into.
I just need to have you on every
Yeah.
month.
Making sure the sleep and again those sedative hypnotics, the trazodone, the Ambiens, it does not give you restorative sleep. So we got to figure out a different way. So that's again, we can deep dive into that another time. Movement, and notice I'm not calling it exercise. Some people exercise just for the sake of exercising. They're getting up at 4:30 in the morning and they're running their 6 miles, but they actually hate it. And that's going to be increasing cortisol. So do the exercise that serves you, that really takes your nervous system down so it can help your cortisol level. I mean, there's studies, 15 minutes of walking a day, what that does to a cortisol level. And you don't need to get up and be on a Stairmaster for 2 hours necessarily. That could actually be stressing you out and making your problems
Yes.
worse. So just know what it works for you. And finally is really tuning into your mind and body and how it's connected and how one affects the other, because this case that I shared with you, it was completely severed. She had no awareness of how it was all connected. And there's so many different ways that you can feel that from the standpoint of what's therapeutic to balance your nervous system so your mind can be at rest, and vice versa with the pain or the distress in your body.
Yes, I love that. And you had even talked about how she would go down to the pools and put her feet in as a way of self-regulating, right?
Yeah.
Which is one of those mind and body
Yeah,
practices that can be so helpful to become fluent at really listening to what you need and balancing all of that out. I love that.
absolutely. Yeah.
Well, Dr. Britta, I think we have a lot of future topics that we could talk about and that are really important to our world because, this is what we're trying to do. We're really trying to have people understand how amazing their human system is, not run to that label of being broken or feeling like you're failure. And you were right on topic with that, with talking about your case and the way you're trying to work to kind of rehab people from over medication if they have been over prescribed medications as a solution for their problems. So I just want to say thank you for being here. And to all of you listening, thank you for joining me on this episode of Whole by Design. I hope it left you feeling inspired to toss out any labels, embrace new perspectives, and take one step closer to the joy and clarity that you deserve. As always, visit www.vivapartnership.com to access our free and low-cost resources that will empower you and your loved ones on health and healing. Let's spread the message, subscribe, review, or share this episode with someone who could benefit from a stigma-dropping approach to mental fitness today. Thanks for being here.
Thank you.